Hello, classmates and professor. My name is Bernice Brockton, and today I will be interviewing Corey Stewart.
How's it going, everybody?
Corey, what is your occupation?
So I'm a 68 X-ray, a behavioral health tech in the United States Army.
And what are the requirements in order to become a behavioral health technician?
So I have to go through a job training, which is called AIT. It's 4 months long. During that, I learn about the different kinds of diagnoses in the DSM-5, which is behavioral health manual for diagnosing things. I also had to learn about the different kinds of medication that is paired with the different kinds of diagnoses. I learned about how to talk to soldiers that are going through mental health crises, which is pretty much called a triage and an initial intake. I also learned about different kinds of like sleeping classes. I learned about how to handle somebody with a suicide ideation or homicidal ideation. At the end of my job training for about 3 weeks, I then went through a internship, and during that I went inside of a psychiatric hospital and actually worked one-on-one with people with schizophrenia, depression, anxiety, suicide ideations, PTSD, things like that. Afterwards, a little bit later on down the road, I learned about the TIM model, which is Traumatic Event Management, and COST model, which is Combat Operational Stress Control. And that was pretty much tailor-made towards deployments. So I learned how to handle people in a traumatic incident overseas, pretty much when we're going through like a combat situation.
And what would be a normal workday for you?
So a normal workday for me is I work inside of a clinic, inside of a brigade. So pretty much I have a certain amount of soldiers that would come by and see me. They basically come by for any kind of mental health issues, and I would conduct either a triage for them or initial intake, which pretty much is me finding out what's going on with them, what brings them in the clinic, and talking them through what is that's going on. I then talk to my provider. My provider could either be a social worker, a psychologist, or a psychiatrist, and they pretty much oversee what I do and come up with a treatment plan for that soldier, which I also have input on. And I also do like sleep hygiene classes. I have my own patient load and help people kind of cope with what it is that's going on with them.
And for someone who is experiencing anxiety, what would be some coping techniques that you would use for that?
So when it comes to anxiety, I guess first we would say, what is anxiety? And anxiety is pretty much your body kind of freaking out. So you'll start with sweaty palms, trouble breathing, you might not know where you are, and you might just really get like kind of claustrophobic. There'll be a bunch of different things that you'll start to feel. There's 2 methods that I normally use to try and bring somebody down from an anxious point. That'll be one, handle their breathing. So one technique that we usually use is the breathing technique, which is you'll inhale through your nose for 5 seconds, hold for 5 seconds, and let out through your mouth for 5 seconds. You'll do this over a period of time, and through that, you kind of regulate your breathing pattern. You'll be able to kind of calm yourself down. If you can handle your breathing, the blood flow, and how you're reacting kind of calms you a little bit. The second way that we would do it is attack your senses. So you have 5 senses, and you would say, okay, well, tell me about 5 things that you can see. Tell me about 4 things that you can hear. Tell me about 3 things you can taste, 2 things you can touch, and 1 thing that you can feel. I think I might have went over the different senses and everything. But with that, you could interchange them and all that kind of stuff. But that's so that you can kind of be aware of your surroundings. You can kind of center yourself and know exactly where you are and that you're not in the situation that probably caused that anxiety.
And in your opinion, do you believe that there's a stigma around mental health?
I definitely believe there is a stigma around behavioral health. The reason for that, especially in the military, is we're supposed to conduct ourselves and be really strong individuals. Mm-hmm. Nothing can get to us. We're pretty much like Superman or Superwoman in a sense. So when it comes to the mental health field, you can't necessarily see a mental health issue. Unlike, you get cut on the leg or you have a bruise, you can see that. But mental health is all in the mind. You can't necessarily see that. So because you have to battle both those things, a lot of people don't seek treatment because they'll be seen as, oh, you're weak, or nothing's really wrong with you. you're just trying to get out of something, a lot of different things like that. And as well as that, some people kind of have the feeling that if they go seek behavioral health, their career might be affected. So there's a bunch of different stigmas that surround the mental health field. It's not a very fun thing to talk about to a lot of people.
And for someone who's in the military and they're trying to seek mental health, is there a certain resource they could use that the military doesn't necessarily have to know about?
So there's multiple different things that soldiers have access to in the Army. You have, of course, me, which is a behavioral health tech, and there's always going to be an embedded unit within brigades and units. So with that, we pretty much keep everything under wraps for the most part. It's kind of on a need-to-know basis. We do document, but only certain people can see that. You also have FAP, which is a family advocacy program, and with them, they don't document anything, but they do help you out with kind of dealing with some of your issues, depending on what it is. You also have Military One Source, and with them, you have 10 treatments that you can do with a civilian off post, and do kind of some mental health therapy.
Thank you for spending time with me today and letting me know about your job experience and about mental health in the military. I really appreciate you sharing some of the coping techniques that you shared for anxiety and your opinion, the stigma that soldiers experience seeking mental health treatment.
I appreciate the time. I appreciate you guys.
Yeah. Thank you, classmates and professor. And this concludes my interview.